Yes, today is the 10th live session on pharmacology module for MRCOG part 1. So today we will have the SBS first single based answer questions. So what we will do in rotations, everyone will answer the SBS. Okay, try to attempt whatever answer you feel, just try to attempt the questions. These are mostly the recall questions which have been asked, at least the questions which have been asked on those concepts. Okay, so understand what type of question which they are asking, so that when you read the theory, you will concentrate on those concepts. Okay, so we'll start. The first, I think, Dr. Priyanka, you can take first and second question. Unmute yourself and read the question and try to attempt this one.
Which of the following antibiotics inhibits bacterial cell wall synthesis by binding to penicillin binding proteins?
Yes.
Is it erythromycin?
Penicillin C.
Okay, Priyanka, go ahead with the next question, second question.
The mechanism of action of aminoglycoside is primarily based on
You can read the options also.
inhibition of DNA synthesis, inhibition of protein synthesis by binding to the 30S ribosomal subunit, inhibition of cell wall synthesis, disruption of the bacterial membrane, and inhibition of folic acid synthesis. I think it's the
Yes,
inhibition of pro- no, disruption of the bacterial membrane.
no. Let's see the answers. Okay.
I don't know.
So the first is C, penicillin. Actually, the question is very clear, and we get confused because it is mentioned clearly penicillin binding proteins. Okay, so whether the penicillin is the answer or not, why is such a clear cut question? But the inhibition of bacterial cell wall synthesis. Cell wall synthesis, they may not mention about the penicillin binding protein. Even if they ask you about cell wall synthesis, penicillin is the antibiotic which acts there. And mechanism of action of antibiotics, at least one SBA will always be there. So please concentrate on the mechanism of action of various antibiotics. So penicillin will inhibit the bacterial cell wall synthesis. Okay, now the mechanism of action of aminoglycosides, the answer given is B, that is inhibition of protein synthesis by binding to the 30S ribosomal subunit. Okay, so here actually there is a one option with 30S ribosomal subunit, the other option will be 50S ribosomal subunit also. Okay, there are some antibiotics which will bind with the 50S ribosomal subunit also. Okay, so we get confused if we just remember that protein synthesis, but when you remember it complete answer. Okay,
So
I hope you are
mechanism of
getting.
action is important for of drugs.
Yes, mechanism of action of antibiotics is important from examination point of view. Okay, and in
Okay.
second question I have cleared that inhibition of protein synthesis. Don't remember only inhibition of protein synthesis. How? By
Yes, sir.
binding to the 30S ribosomal subunit, because you will have another antibiotic which will bind with the 50S ribosomal subunit. Okay. So we go ahead with the next question. Next, Dr. Amrita, take this question. This which class? Dr. Amrita, or who is there? Dr. Amrita, you can unmute yourself.
Oh. Which antibiotic class works by inhibiting bacterial DNA gyrase and topoisomerase 4, preventing DNA replication?
Yes, DNA, bacterial DNA gyrase and topoisomerase.
Option A, tetracyclines.
Okay, we'll see. Go ahead with the next
The
question.
mechanism of action of macrolides like erythromycin involves inhibition of cell wall synthesis. Option B, inhibition of bacterial protein synthesis by binding to 50S ribosomal subunit. Inhibition of DNA replication. Disruption of bacterial cell membrane. Inhibition of bacterial folate synthesis. B, inhibition of bacterial protein synthesis. by binding to
By
50s
50.
ribosomal subunit.
Okay, let's see the answer. Okay, so actually this is a question 3 and question 4. The question 3 answer is
Fluoro.
fluoroquinolone.
Okay.
Okay, and
Yes, sir.
question 4 is inhibition of bacterial protein synthesis by binding to 50s ribosomal subunit. Okay, so this macrolide, that is erythromycin, will inhibit the bacterial protein synthesis by binding to the 50s ribosomal subunit. Okay, so initially what we have seen, this aminoglycoside, it will inhibit the protein synthesis by binding to the 30s ribosomal subunit. Okay, you got the difference.
Yes, sir.
And there may be two options, then we will get confused if we just remember inhibition of bacterial protein synthesis. Okay, so unnecessarily we'll lose 1 mark there. Now who will answer? Dr. Sansi.
Uh, which of the following oxytocic agent works by stimulating uterine smooth muscle contraction via its effect on oxytocin receptor? Methyl, methyl ergonovin, misoprostol, oxytocin, ergometrin, carboprost. So, oxytocin is oxytocin. C.
Yes. Yeah, yeah. Clear. Next.
Methyl, sixth option, sixth question. Methyl ergonovin is an oxytocic agent that primarily acts by directly stimulating uterine muscle contraction, inhibiting the uterine smooth muscle relaxation, acting on alpha adrenergic receptors to cause vasoconstriction, blocking the prostaglandin receptor, increasing the release of oxytocin, directly stimulating the uterine muscle contraction.
Option A.
Correct.
Option.
Yeah, yeah. So the question for your answer is oxytocin, and next question, directly stimulation of the uterine muscle contractions. Okay, that is ergot derivatives will act by that mechanism. Now next, Dr. Priyanka, you'll try again this seventh and eighth.
Yes, sir. Which of the following drugs is a synthetic prostaglandin, a long analog used to induce labor and control PPS? Synthetic prostaglandin is carboprost, and sorry,
Read the question carefully, doctor.
which of the following drug is a synthetic prostaglandin analog used to induce labor and control PPS?
Read all the options.
Carboprost, oxytocin, ergometrin, misoprostol, and methyl ergometrin. It will be prostaglandin analog induced labor.
Labor induction and PPS
Misoprostol.
component.
Meso, because
Misoprostol.
oxytocin is not synthetic, it's natural. So,
No, they are asking
misoprostol.
the prostaglandin. They are asking the prostaglandin.
Synthetic prostaglandin, yes, sir.
Here, how many
Uh,
prostaglandins you have? Only two options you have: carboprostol
Misoprostol
and
and
misoprostol.
oxytocin, yes, sir. So,
Okay, rest are
misoprostol
not
can be.
prostaglandins, no? Okay,
Yes, sir.
so remember that way. So read the question carefully. Then what happens when you finish your paper? Then you realize, no, no, you have not read the question properly, and that is why you actually know the answer. Okay, so
Yeah.
go ahead with the next question.
Which of the following tocolytic agent works by inhibiting uterine smooth muscle contraction via the beta 2 adrenergic receptor activation? So, terbutaline.
Yes, terbital. Okay. So the question 7 answer is misoprostol. Question 8 answer is terbital. Okay. Now, Doctor, who will answer us? Sinchana.
Uh,
Next.
which drug is commonly used as tocolytic agent by inhibiting prostaglandin synthesis? A. Magnesium sulfate. B. Nifedipine. C. Indomethacin. D. Terbutaline. And E. Labetalol. C. Indomethacin.
Prostaglandin synthesis inhibition.
Synthesis
Okay.
inhibition. Magnesium sulfate is used as a tocolytic agent and works by A. Inhibiting calcium influx into the uterine muscle cells. B. Blocking the action of oxytocin. C. Increasing the release of prostaglandins. D. Stimulating uterine muscle relaxation through alpha adrenergic stimulation. E. Inhibiting uterine smooth muscle contraction via beta 2 adrenergic receptor. Answer A. Inhibiting calcium influx into the muscle cells.
let's go towards the answer. So question 9 answer is indomethacin, and question 10 is inhibition of calcium influx into the uterine muscle cell. Just remember that magnesium and calcium are antagonistic to each other, and magnesium mechanism of action is inhibition of calcium influx into the uterine muscle cells. Okay, and calcium is used as a antidote for magnesium sulfate. Okay, for reversing the action of the magnesium sulfate. Now next Dr. Amrita is there. She rejoined.
Yes, sir.
Can I?
Yes, sir.
Question 11 and 12. Go
Yes,
ahead.
sir. Uh, Question 11. Which of the following is commonly used for medical abortion in combination with mifepristone to induce uterine contractions? Option A, methotrexate. Option B, misoprostol. Option C, oxytocin. Option E, ergometrin. Option E, carboprost. Sir, the answer is option B, misoprostol.
Correct. Next
Yes.
question.
Question number 12. Mifepristone used in medical abortion acts by option A, stimulating uterine contractions, option B, blocking progesterone receptors to disrupt the maintenance of pregnancy, option C, inducing cervical ripening, option E, inhibiting the release of luteinizing hormone, option E, inhibiting prostaglandin synthesis. Sir, the answer is option C, inducing cervical ripening.
B, blocking
Mifepristone.
progesterone receptors.
Who? Dr. Sinchana says B.
Yes, sir.
Sir,
Okay.
sir, C.
Mifepristone. And what does
C.
mifepristone mechanism of action?
C, sir.
It's a anti-progesterone, no?
Anti. Okay.
So it's
Mechanism
a
of action.
yeah. So question 11 is misoprostol, and question 12 is a blocking progesterone receptor to disrupt the maintenance of pregnancy. Okay. Next, Dr. Priyanka.
Which of the following antihypertensive agent is considered safe for use in pregnancy to manage hypertension? Lisinopril, methyl dopa, losartan, atenolol, and amlodipine. So it is methyl dopa B.
Yeah. Next question.
Uh, which antihypertensive agent should be avoided during pregnancy due to the risk of fetal renal damage and oligohydramnios? Options are hydralazine, methyl dopa, ACE inhibitor, nifedipine, and labetalol. So it is ACE inhibitor. See?
Correct.
Yes, inhibitors.
Yeah. So question 13 and 14. Question 13 is methyl dopa. Question 14 answer is AC inhibitors like enalapril. Okay. But remember, enalapril is safe in the postnatal period. Antenatally, it is contraindicated, but it is a drug of choice in the postnatal period for preeclampsia. Okay. So that option you have to remember. It is safe in the breastfeeding mothers. Okay. Now, question 15, Dr. Sansi is there.
Yes, sir.
Uh, Go
Labetalol
ahead.
and 15th question. Labetalol, an antihypertensive agent used in pregnancy, acts primarily by blocking calcium channels in smooth muscle, blocks beta adrenergic receptors and alpha 1 receptors, inhibiting the renin-angiotensin system, reducing the heart rate through a central action, or dilating the blood vessels through nitric oxide release. So it's a beta blocker, so blocking beta adrenergic receptors and alpha 1 receptors.
So, option B. Okay.
Yes, please.
Next question.
Uh, which of the following antihypertensive drugs is commonly used in the acute management of severe preeclampsia or eclampsia in pregnancy? Hydralazine, option A, option B, methyl dopa, option C, labetalol, option D, amlodipine, option E, nifedipine. Sirs, option C, labetalol.
Acute management of severe preeclampsia or eclampsia in pregnancy.
Actually,
Antihypertensive drug
Uh,
in acute management.
hydrolazine, hydrolazine is used for acute management of PP control. Option A.
Yes. So,
yes.
definitely, your answer is not wrong. What Dr. Sansi has answered, but read the question. They are asking in acute condition, okay, where you want to reduce the blood pressure very quickly. Sometimes they may give the clinical scenario with values also. Okay. So the question 15 answer is action of labetalol is blocking the beta adrenergic receptors and alpha 1 receptors. That is alpha plus beta blocker. And next is hydrazine. Okay. Next question, Dr. Sinchana,
Which
17
of
and
the following anti-epileptic drugs is considered the drug of choice for managing generalized tonic-clonic seizures during pregnancy? A. Phenytoin, B. Lamotrigine, C. Valproate, D. Carbamazepine, and E. Topiramate. Uh, B. Lamotrigine.
next question.
Which of the following anti-epileptic drugs should be avoided during pregnancy due to its association with neural tube defects? A. Valproate, B. Lamotrigine, C. Phenytoin, D. Levetiracetam, and E. Carbamazepine. A. Valproate.
Correct. So valproic acid is contraindicated. So question 17, lamotrigine. Lamotrigine is safe in pregnancy. So lamotrigine is the drug of choice, and valproate is to be avoided because it causes neural tube
Neural
defect.
tube defects. Yes.
Correct. Next, I think these are the last two questions. Who will answer? Dr. Priyanka, you want to take these 19 and 20?
Yes, sir. Which of the following is a contraindication for the use of mifepristone in medical abortion? Ectopic pregnancy, anemia, previous cesarean delivery, history of depression, and uterine fibroids. I think it is previous cesarean delivery. And
Mifepristone.
mifepristone, ectopic, I'm not sure.
Okay, go ahead with the next question.
Which of the following anticoagulant is considered safest for use in pregnancy?
Depression.
Warfarin, LMWH, rivaroxaban, dabigatran, and fondaparinux. It is LMWH.
Correct. LMWH. So ectopic
Ectopic.
pregnancy is definitely because mifepristone has got no role there.
Right.
Okay. And next is a low molecular weight heparin. That is the
Yes.
safest. Okay. Ectopic pregnancy. What is the medical management?
Methotrexate.
Methotrexate.
Yeah. So there is no role of mifepristone.
Multiple dose regimen. Yes.
Okay. Next, I think few questions are there. Dr. Sinchana, you want to answer?
Yes, sir. Which anticoagulant is contraindicated in first trimester due to its teratogenic effects? A. Unfractionated heparin. B. Apexabil. C. Warfarin. D. Enoxaparin. And E. Dalteparin. C. Warfarin.
Correct. So it causes warfarin
What
embryopathy.
embryopathy? Which of the
Next
following
question.
drugs is most strongly associated with neural tube defects when taken during pregnancy? A. Phenytoin, B. Isotretinoin, C. Valproic acid, D. Methotrexate, and E. Lithium. D. Methotrexate. Most strongly.
I think it is
It's
valproic
valproic
acid and
Valproic
acid.
lithium
acid.
because if you no other answers are not absolutely wrong, but highest association. If you see, I think it is 10 to 12% or something like that. Properly, they have given the percentage of malformations when the mother takes that particular. So highest will be with valproic acid. Okay.
Okay.
Next question, Dr. Amrita.
Yes, sir. A pregnant woman on ACE inhibitors during the second and third trimester is at the risk of fetal, option A, cleft palate, option B, neural tube defects, option C, renal dysgenesis and oligohydramnios, option D, cardiac septal defects, option E, limb abnormalities. So the answer is option C, renal dysgenesis and oligohydramnios.
Correct. The
Uh,
same question is reverse. Initially, we have seen this particular question. Okay. Next, go ahead.
Yes. Question 24. First line drug for eclampsia seizures. What is the first line drug for the prevention and treatment of eclamptic seizures? Option A, diazepam. Option B, phenytoin. Option C, magnesium sulfate. Option D, labetalol. Option E, hydralazine. Sir, option C, magnesium sulfate.
Correct. So, question 13 renal agenesis and question 24 is a magnesium sulfate. Next, Dr. Sansi. Dr. Sansi,
Yes,
your yeah.
methotrexate exerts its anti-cancer effects by inhibiting which enzyme? Topoisomerase 2, dihydrofolate reductase, thymidylate synthase, RNA polymerase, tyrosine kinase. So option B, dihydrofolate reductase.
Okay.
20,
Next
26.
question.
Which of the following anti-cancer drugs is most commonly associated with dose-dependent cardiotoxicity? Cisplatin, doxorubicin, methotrexate, paclitaxel, bleomycin. Option B, doxorubicin.
Correct, correct. Okay. So, question 25, DHFR, that is dihydrofolate reductase, and question 26 is the doxorubicin, which causes cardiomyopathy or it is a cardiotoxic agent. Okay, Dr. Sinchana, question 27, question 28.
Yes, sir. Which of the following adverse effects is most characteristic of cisplatin therapy? A. Pulmonary fibrosis. B. Ototoxicity and nephrotoxicity. C. Hemorrhagic cystitis. D. Peripheral neuropathy. E. Cardiotoxicity. I think it is B. Ototoxicity and nephrotoxicity.
Yes, cisplatin, it ends with N, and this side effect starts with N, that is nephrotoxicity. Okay, so
Yes.
cisplatin, nephrotoxicity, and ototoxicity is also there. Okay, next question.
Which dopamine agonist is preferred for treatment of infertility caused by hyperprolactinemia? A. Cabergoline, B. Bromocriptine, C. Pergolide, D. Guanacolide, and E. Luprolide. B. Bromocriptine.
Dopamine agonist is preferred in the treatment of infertility caused by hyperprolactinemia. So the
Okay.
question 27 option is correct answer is ototoxicity and nephrotoxicity, and cabergoline is the drug of choice for the hyperprolactinemia. Okay.
Yes, sir.
Nowadays we prefer cabergoline. Next, Dr. Priyanka, last question of
So,
this.
which drug is first-line therapy for ovulation induction in women with PCOS? It is letrozole, clomiphene citrate, metformin, bromocriptine, and HCG. The answer is letrozole.
Go ahead with the
And
next question.
which of the following gonadotropin formulations is most commonly used for controlled ovarian stimulation in ART? It is HCG, recombinant FSH, clomiphene citrate, letrozole, and luprolide. So it is luprolide, gonadotropin formulation.
COH, controlled ovarian
Gonadotropin,
stimulation.
FSH, recombinant FSH.
Yes. And 29,
Okay.
which drug is a first line therapy is a clomipene citrate.
Letrozole.
If you,
Letrozole.
it is
Letrozole.
clomipene citrate. If you see all RCOG, it is still they are
Oh,
using
yes.
clomipene citrate as a first drug of choice. Okay.
Okay.
There is a little difference in the practice at here and what they practice in the UK. The drug of choice, wherever you will read in infertility, you will find the first answer as a clomipene citrate. Okay. So the question 29 is a clomiphene citrate and question 30 is a recombinant FSH. Okay.